Whiplash is a type of neck injury caused by the sudden jerking motion of the head, typically resulting from a rear-end car collision, though it can also occur in other situations like sports accidents or falls. It occurs when the head is quickly forced backward and then forward, causing the neck muscles and ligaments to stretch or tear. Causes of whiplash. Whiplash is most commonly caused by car accidents. The most frequent cause of whiplash is a rear-end car collision, where the force of the impact causes the head to snap backward and then forward. Sports injuries. High-contact sports like football, rugby, or boxing can cause sudden jolts to the neck. Falls. Falling from a height or slipping can lead to a whiplash-like injury if the head is jerked suddenly. Physical assault. Whiplash can also occur due to being struck or shaken violently. Symptoms of whiplash. Symptoms of whiplash can vary from mild to severe and may appear immediately after the injury or take hours or even days to develop. Common symptoms include neck pain and stiffness, the most common symptom, usually felt immediately after the injury. Headaches. Typically, these occur at the base of the skull and can spread to the forehead. Dizziness. The feeling of lightheadedness or vertigo can accompany whiplash. Shoulder, upper back, and arm pain. The injury can cause pain that radiates down into the shoulders, upper back, and even arms. Numbness or tingling. This may occur in the arms and hands due to nerve involvement. Fatigue. Feeling unusually tired or fatigued is common after a whiplash injury. Jaw pain or tinnitus. In some cases, whiplash can cause jaw discomfort or ringing in the ears. Difficulty sleeping. The pain and discomfort can make it difficult to sleep. Diagnosis of whiplash. The diagnosis of whiplash is often based on a physical examination and the patient's history. Your doctor may ask about the details of the injury, including the type of accident or trauma that caused it. Imaging tests may be recommended if the doctor suspects that there might be additional damage to bones or tissues. X-rays. While not always necessary, X-rays may be used to rule out fractures or other issues. MRI or CT scans. These imaging techniques are more useful in detecting soft tissue injuries, such as ligament tears or disc damage. Neurological exam. This may be performed to assess any nerve damage, especially if there is numbness, tingling, or weakness in the arms. Treatment of whiplash. Treatment for whiplash aims to relieve pain, promote healing, and restore mobility. The approach will vary depending on the severity of the injury. 1. Self-care. Rest. Initially, rest is recommended to prevent aggravating the injury. However, prolonged bed rest should be avoided, as it can hinder recovery. Ice and heat. Applying ice for the first 48 hours can help reduce inflammation, while heat after the initial period can relax the muscles and improve circulation. Pain relief. Over-the-counter pain relievers like ibuprofen, Advil or acetaminophen Tylenol can help alleviate pain and inflammation. 2. Physical therapy. Physical therapy is a cornerstone of treatment for whiplash. A therapist will guide the patient through exercises to improve neck strength and flexibility, promote healing of soft tissues, reduce pain and stiffness. Techniques such as heat therapy, massage, and manual manipulation may also be used. 3. Medications. Muscle relaxants. These may be prescribed if the pain is severe and related to muscle spasms. Corticosteroids. In cases of severe inflammation, the doctor may prescribe corticosteroid medications to reduce swelling and pain. Antidepressants or anti-anxiety medications. These may be helpful if the patient experiences chronic pain or emotional distress as a result of the injury. 4. Neck brace or collar. The neck brace or collar may be used in the short term to immobilize the neck and support healing. However, long-term use is discouraged because it can weaken neck muscles and hinder recovery. 5. Chiropractic care. In some cases, chiropractic adjustments or spinal manipulations can help alleviate pain and restore normal motion in the neck. This should only be done under the supervision of a trained professional. 6. Injections in more severe cases. An injection of corticosteroids or nerve blocks may be used to target specific areas of pain, especially if conservative treatments are not effective. Recovery and prognosis. The recovery time for whiplash varies from person to person, depending on the severity of the injury. Mild cases may heal in a few weeks, while more severe cases can take months or longer. Most people experience a full recovery, but some may develop chronic pain, stiffness, or other long-term symptoms. Common recovery timelines. Mild whiplash. Symptoms may improve in 2 to 3 weeks. Moderate whiplash. It may take 6 to 8 weeks for full recovery, though some individuals may continue to experience symptoms for a few months. Severe whiplash. Recovery can take several months, and there is a risk of long-term issues such as chronic pain or post-traumatic stress disorder (PTSD) related to the injury. Chronic whiplash syndrome. A small number of people may develop chronic whiplash syndrome, where symptoms last longer than expected and interfere with daily life. This condition can include persistent pain in the neck, shoulders, and upper back, headaches and dizziness that do not improve with time, psychological symptoms such as depression or anxiety, which can result from long-term pain or the traumatic nature of the injury. Treatment for chronic whiplash may involve a multidisciplinary approach, including pain management, physical therapy, psychotherapy, and sometimes alternative treatments like acupuncture. Preventing whiplash. While some whiplash injuries are unavoidable, certain measures can help reduce the risk or severity. Proper headrest position. Adjust your car's headrest so that it supports the back of your head and is aligned with the top of your head. This reduces the risk of neck injury during a rear-end collision. Good posture. Maintaining good posture when sitting, standing, or sleeping can reduce the likelihood of strain and injury to the neck. Seat belt use. Always wear a seat belt, as it helps prevent being thrown forward during a collision, reducing the chance of a whiplash injury. Avoiding distractions. Pay attention while driving to avoid accidents and collisions. When to see a doctor. If you experience any of the following after a whiplash injury, seek medical attention immediately. Severe neck pain that doesn't improve with rest. Numbness or tingling in the arms or legs. Headaches that worsen or do not go away. Dizziness or vision problems. Difficulty moving the neck or complete loss of movement. In conclusion, whiplash is a common neck injury, often caused by sudden, forceful movements like those seen in car accidents. Most cases resolve with appropriate care, but it's important to manage symptoms promptly to ensure a full recovery and avoid long-term complications.